I am happy to answer questions at the end, but also if you have a question about a particular slide, just let me know. I can certainly stop and go. So thank you guys for having me. I really appreciate it. Today we are going to talk about a lot of audiology, a lot about the brain, a lot about hearing, and kind of the connections with everything. So the learning objectives today are understand, how we hear. So hearing is a very complicated system, and the important connection between your hearing and your brain. Understand the two important components of most effectively treating your hearing loss, and understanding how to improve speech understanding abilities, especially in challenging listening environments. So first, I'm going to play a little video. It might be hard to hear. Sorry, I just fast forwarded through it. I'm going to try.
Ears are constantly active. They pick up sound waves and change them into information that the brain can interpret, such as music or speech. Sound is a pressure wave that can vibrate either quickly or slowly. Slow vibrations produce deep sounds, while quick vibrations produce high-pitched sounds. Sound enters the ear and is directed through the ear canal, where it first reaches the eardrum. As the eardrum begins to vibrate, it sets the ossicular chain in motion. The ossicular chain consists of the hammer, anvil, and the stirrup. Sound vibrations move along the ossicular chain and into the inner ear. Within the inner ear, the cochlea plays a central role. It is here that the mechanical energy of sound is converted into complex electrical signals, which are then passed on to the brain. In simplified terms, the cochlea is a spiral-shaped tube filled with fluid. Sensory cells, also called hair cells, line the entire length of the cochlea. These hair cells have varying degrees of sensitivity for the detection of different tones or frequencies. This allows the ear to perceive the entire spectrum of sound. The change from mechanical vibration to electrical pulse is a complex process resulting from the movement of hair cells in the cochlea. Along the entire length of the cochlea, the hair cells are arranged like the keys of a piano. Hair cells located at the base or lower region of the cochlea are responsible for high frequency, while hair cells at the apex are responsible for the low frequencies.
Okay.
As the fluid in the cochlea is set in motion, it causes a corresponding movement of the fine structures on the surface of the hair cells to take place. These movements cause tension differences which produce electrical signals that are passed along the hearing nerve to the brain. The auditory cortex of the brain interprets this information as sound, for example as music or speech. The entire chain of events, including the various steps that convert sound waves from the environment into information that the brain can interpret, happens so fast that individuals can hear sound both continuously and instantaneously. Within this complex chain of events, there are a number of factors which can cause an individual to experience hearing loss. A loss of hearing can range from a mild to moderate hearing deficiency to a total hearing loss. In general, there are three main types of hearing loss which differ from one another depending on the part of the ear that is affected, be it the outer, middle, or inner ear.
Okay. So that was just a quick little video explaining the complexities of how we hear and how it's not just this very simple process. So, our brain, again, is a big portion of how we hear. So our ears are collecting the sound, but the brain now has to decode and make sense of that. And so we're going to talk a little bit more about that. So, again, we hear with our ears, our brains are what process the sound. So, talks about hearing loss and how we talked about the three different parts, the outer ear, the middle ear, and the inner ear. 90% of hearing losses that we diagnose are typically in the inner ear, meaning damage to those little hair cells. Where the hair cells have gotten damaged, there's a lot of causes that can occur, whether it's the natural process of aging, genetics play a big factor into it. So if you think, oh, my parents had hearing loss or my aunts and uncles had hearing loss, that definitely puts us at a greater risk. And then there are health conditions such as diabetes, high blood pressure, thyroid problems, autoimmune diseases, all also put us at a much greater risk for our hearing loss progressing, getting worse over time. Because hearing loss is mostly going to be inner ear related, it affects the high frequencies. So if you remember that little snail-like structure, the cochlea, at the entrance or the base of that are the high frequencies. And so they kind of get abused a lot in our lives day to day. And so they're the ones who get, you know, that first burst of sound. And so because of that, they are the ones that tend to deteriorate the most. Versus in the center, the base ear sounds tend to be more protected and less likely to have hearing loss in that range. The high frequencies, though, are very important because that's where the clarity comes from. The consonants are located there. So an example of not understanding but hearing, because patients say that all the time, I hear, I just can't understand what somebody's saying, is I use the example of somebody says to you, Kerrigan, what kind is it? And Kerrigan goes, it's 10:15, because she heard, Kerrigan, what time is it? Not what kind is it, right? That sentence almost sounds identical, but you take a K and a T and you switch those and the meaning of that sentence is completely different. And that's what we mean, it just takes that one letter switch for it to be very difficult for your brain to kind of follow. And the high frequencies are also voiced at a much softer level, so it doesn't take a lot of hearing loss to start to have that become an issue. So we talk about, again, a little bit here, most people have difficulty with an example, chair, stare, fair, tear, and pair, distinguishing between those different words. And we talk about effort versus challenging. So there's a different, like I always explain that hearing is a passive process. It's not something that we should actively be focusing. And you can sometimes see when somebody's got hearing loss and they have like an intensity in their eyes where they're really following what your lips are doing. And that's because, unfortunately, whether their loss is corrected or maybe it's not corrected, they have to work a lot harder just to be able to process that information because they're missing a lot of the detail. So we have a little exercise where we have everybody, if you can, we'll have you read the word, and as that, every slide will have a word, and I'll keep going, and I'm going to have you guys just read it out loud. So I'll cue you, and then I'll go to the next one, and then you guys can just keep repeating them. So the word now.
Toast, basket, table, lunch, tracks, blinds, glass, washer, buckle, stones, shoes, lunch.
So as you guys, that's a good little exercise to kind of give patients an idea of what it's like to try to listen with hearing loss. Mm-hmm. And as you saw, the more, you know, kind of unique that spelling got, the harder it was for you to quickly be able to repeat that word back. And that's something very similar that happens with hearing loss when we don't have the right amount of detail. Our brain has a much harder time interpreting everything. So it leads to patients feeling cognitively just overloaded and tired, exhaustion, there's misunderstandings, and a lot of frustration can happen with hearing loss. So it's not just can you hear, can you not hear? There are a lot of negative social effects that happen because of hearing loss that's untreated. So some common signs that we hear quite a bit are people saying that, you know, everybody's mumbling. You say you can understand, but you can't hear. It becomes harder and harder to follow conversations as the environment gets more complex, like a restaurant or large group setting. And because of that, then patients can very slowly but surely start to pull away from social activities that they used to enjoy. And that is not what we want patients to do. We want you to continue to engage and do all of the things that you find enjoyable. So some common signs of hearing difficulty. Another very common sign of hearing loss is tinnitus or tinnitus, and it is known as a ringing, humming, swooshing. For most patients, they'll report it as a ringing. It's a sound that you can hear that nobody else can hear. It can be in one ear, it can be in two ears, but it's very, very common, and it is one of the first signs for a lot of people that there's damage to their auditory system. And sometimes it'll be the first sign before hearing loss is even clinically diagnosed. But it is something to certainly investigate if you start to suddenly develop some ringing, buzzing, roaring. It can sound like a plethora of sounds to people. And then roughly 10% of the adult population experiences tinnitus. And tinnitus is different than what we call a transient ear noise. I think everybody has experienced a minute or two of a potential sound that they hear in their ear and it just kind of disappears. That's normal. Our ears make noise. But tinnitus is something that is constant and it doesn't go away. So again, talking a little bit about the signs of hearing loss, many people kind of ignore that in the beginning. Tinnitus decreases when people with severe hearing loss and hearing loss when they use hearing aids. Because if you think about it, I always explain that tinnitus is the absence of sound. It's your brain's maladaptive behavior, that it's created this sound because of the lack of sound. And so if we put a hearing aid on, then suddenly you're having access to all of these sounds, whether they're environmental or speech, and your brain has far more stuff to pay attention to, then it's not going to focus on this other negative sound. As of right now, there is absolutely no cure for tinnitus. If there's no magical pill that you can take, the only thing that can really be used to treat it is to treat your hearing loss, because it is a symptom of damage to the auditory system. A little bit about hearing loss stats. So about 17% of American adults, or 36 million Americans, have some degree of hearing loss. That's a lot of people walking around. Hearing loss has been cited as the third most common health-related problem in America, and half of the individuals that are hearing impaired are going to be over the age of 65. So hearing loss kind of disrupts that normal relationship between your ears and your brain. So your brain receives less information, makes it harder for your brain to decode. You have to guess what people are saying. The extra effort leaves you less capable of recalling the auditory information that you got. You feel more tired after conversations because you just had to work a lot harder. And so that can tempt people to just kind of pull away from social interactions. I like to tell stories because I have a lot of patients, and I had a patient of mine come in and she does like a cousin brunch, and there are like 16 of them that meet and they do it once a month. And she was just saying, like, it was such an important part. She loves connecting with her family, but because of her hearing loss, she said, what's the point? Go and do what? I can't hear anybody. She was like, I can hear one person next to me. They get irritated that I keep asking them to kind of be my interpreter. And she's like, so I just don't go anymore. And that's exactly how it happens. It's not overnight. It's not just one incident. It's these little things. And, after not doing that for like a year, she lost, a lot of connections and social interactions that she was really enjoying. So the goal is always to get you back into those things that you enjoy. So some negative consequences of hearing loss that's been linked. So higher connection to anxiety, depression, again, kind of, that story, a decreased self-esteem. She wasn't feeling very confident. Social isolation, memory problems, and cognitive decline, which we'll definitely go more into. Risk of falling, so that's kind of a more recent studies have shown that there's a connection between hearing loss and fall risk. And then decreased earnings in the workplace. So this is a larger study that was done talking about hearing loss and cognitive decline over time. And I was gonna see, basically what the study showed was it followed three groups. So the first group, normal hearing individuals over 25-year period. This was done at Hopkins. The second group was individuals with hearing loss who consistently wore their hearing aids every day. And then the third group were a group of individuals identified with hearing loss who did not have any kind of treatment. And what they found over that time period was the individuals with normal hearing and the individuals who had hearing loss but wore hearing aids had kind of the same gradual decline over 25 years in cognition, okay? The group with hearing loss who did not treat theirs had a much greater risk over time, and their cognitive decline was much steeper and much faster over that time period. So that's how we kind of came to understanding that cognitive decline and hearing loss kind of go hand in hand. It's actually the #1 modifiable risk factor. I tell patients we can't change our genetics. Well, a little bit we could. There's things that you can do, stay healthy, take care of yourself. But there are certain things like if Alzheimer's runs in a family, for example, my grandmother had Alzheimer's, I know I'm at a greater risk because of that. But if I, do a good job eating well and I exercise and I try to take care of myself and then I treat my hearing loss, should I start to have hearing loss, I'll be at a much better outcome as far as that potentially, that gene kind of being exposed. Oh, motion sensor. So this was just a kind of a quick slide. So the more hearing loss you have, the more at risk you are for the dementia. So mild loss puts you 2 times, moderate loss 3 times, and obviously severe 5 times more likely. This was a more recent study, the Lancet, where they looked at different factors and they really kind of focused on age in this one. And so what they found was that that between the ages of 55 and 65 was actually like the most impactful as far as reducing your risk of dementia. And so that was something that was kind of new, because a lot of times when somebody comes in to get their hearing loss or their hearing tested, we are finding that patients are younger and younger and younger, because hearing loss does start in our 50s for most of us. Doesn't always mean we need treatment. We might not need treatment until we're in our 80s, but it's always a good idea that if we do have hearing loss to kind of keep an eye on it just for that progression over time. But this study was really looking at, well, when can we make the biggest impact? And it's basically, if you get diagnosed, even if your loss is mild, between the ages of 55 and 65 will have the greatest impact on reducing your risk. We talked a little bit about this, where I popped in talking about how these are other health conditions that are connected. So cardiovascular disease, depression, the risk of falling, chronic kidney disease, I think I didn't mention that. The mortality one, so I was like, the other day when that study came out, I said, so if you have hearing loss and you don't treat it, you're more likely to die. And I was like, I need more information here. I'm not understanding what that means. And the study was basically looking at individuals who just don't take care of themselves, right? If you don't go to the doctor and we were just talking about this in the car, you don't go to the doctor, you don't go to the dentist, you don't go to your eye doctor, you don't get your yearly physicals, right? Then you're more likely to have hearing loss that you also kind of ignore. And all of those factors combined, you just have a higher mortality rate, right? Because you're not taking care of yourself. Versus individuals who identify that they have hearing loss and then treat their hearing loss are more than likely taking good care of themselves. They're going to their annual appointments. They're getting, their eyes checked. They're going to the dentist. And so that was what that study was looking at. And then, again, the diabetes, and then the Alzheimer's and the dementia. So giving your brain access to sound. Hearing aids aren't perfect. I always say it's a hearing aid, not a hearing cure, but 95% of patients should and could be helped with hearing aids. And so there are the exception to the rule. I always say bell curve, where somebody might not be able to be helped, whether they have very poor word understanding. But then at that point, we can talk about different options. That could be potentially a cochlear implant. You have to try a hearing aid first and show that you're not successful with it and that it's kind of, you've reached the limitations of it. Because a cochlear implant is a great option. It's awesome that it's an option for patients, but it's not perfect, and it takes a lot of work and a lot of rehab, and your brain has to learn how to hear a very different way. So hearing aids are always the first step, and then if those aren't working, you're not successful, then there's always a cochlear implant, which is a different type of device. So this was talking about the benefits of treating your hearing loss. 71% of people who wear hearing aids report an improvement in life overall. 74% of hearing aid wearers report an improvement in their relationship at home. So I get a lot of husband-wife combos that come to the office, and sometimes you can really just like feel the tension between them because one's very frustrated by the other, and you know, that's your communication partner. You live with them, you communicate with them every day. It can be very frustrating if you know, somebody has a hearing loss and they're not treating it for the not only the person with hearing loss, but also their partner, who can get frustrated by that. And then 67% of hearing aid wearers report an improvement in self-esteem. So again, just having the confidence to go out and feel like you can go out to a restaurant, or you could attend a group meeting and participate. So the Journal of American Geriatric Society, hearing loss is associated with accelerated cognitive decline. This was the 25-year study, so I actually went ahead. The first one was just talking about how initially they found that there was a cognitive decline over time. This was talking about like the difference with like the hearing aid effect. So again, you know, if you've got 3 groups and we're seeing a little decline over 25 years, that other decline was much steeper with the group who didn't treat their loss. As you age, some basic cognitive skills, working memory, the ability to pay attention to a speaker and noise or process information quickly begins to decline. And to explore the effects of hearing loss on brain function, they evaluated individuals in their 50s and 60s with hearing loss who had never worn hearing aids. And after only 2 weeks of consistently wearing hearing aids, they were able to improve these different areas of cognition. So patients were able to recall words in working memory, selective attention, so being able to focus, and then processing speech. So that's a very short period. There's another study that we didn't put on here, but I went to a conference and they were talking about basically doing an MRI and then fMRI, where actually the brain like lights up in different parts. And what they showed was that individuals, even with a very mild loss, is that your brain starts to rewire itself. So we hear and process speech in our temporal lobe, but the sound started processing in the frontal lobe. So started using our vision to compensate for even a mild loss. And they, you know, they identified that, and then again, 2 weeks of just wearing a hearing aid, and they saw that area that was lighting up in the frontal lobe suddenly go back to where it should be, which is the temporal lobe. And so that was another very interesting study that was showing whether you're aware of it or not, there are changes that are happening in your brain that don't have to happen. And so it's moving into an area to support and supplement where you're having difficulty. Having amplification, treating your loss, allows your brain to go back to the areas where it needs to process sound. So talking about like a personalized approach to hearing aid fitting. So, you know, a big part of being successful in treating your hearing loss does have to do with where you go, and making sure that you're going somewhere where they are following best practices, and I'll talk a little bit about that in a minute, but best practices basically means we have to have some kind of objective measurement. Say somebody's had hearing loss for 10, 15 years, and we say, how's that sound? I don't know, I guess it sounds okay, I don't remember. And so we put a little tiny microphone in the ear that measures the output. So we take into account individual ear anatomy, we take into account your hearing test, which is your prescription, and so we're able to get a much more accurate first fit when somebody does decide to seek treatment, because one size does not fit all. Talked about this a little earlier, how a hearing aid is not a hearing cure, so we know hearing aids are effective. They're an important first step, but many people still wear hearing aids and still report that they're frustrated that they can't understand people talking and what they're saying, and there's a reason behind that. So because hearing is complicated, it takes place in the brain. We've already talked a little bit about that. So when your brain gets information, it has to figure out like, where did the sound come from, right, left, up, down. You have to focus then on that conversation, right? So you imagine you're at a table, you want to hear this person and not this person. You have to focus, right? If you don't have hearing aids, your brain is telling you, I'm going to ignore these people and I'm going to focus on this person. And then you have to be able to recognize the information and then separate the speech from the noise. These are all things that happen automatically when you have normal hearing, okay? So training your brain to better understand with auditory training. So similar to physical therapy, which strengthens your body, auditory training is an exercise that helps your brain make sense of sound. So it's called LACE AI, and it's an auditory training program that's clinically proven to help cognitive and working memory. So that is another thing that we offer in addition, not just the amplification, you have the LACE AI. So like, here's the hearing aids to get the sound to your brain, but now what does your brain do with that information? So LACE AI has been around a very, very long time. I did a lot of my thesis on this particular gentleman, Robert Sweeto, who created LACE AI. But when I graduated, like, it was on a floppy disk or a CD-ROM, and you would put it in your computer, and there wasn't like an online system. So how did we like check the patient progress? Now it is on your phone. It is on a tablet. Soon it will be on a desktop, and it is using artificial intelligence. And so it is tailored to your skill set. So as you get better, or if you're really struggling, it self-adjusts the difficulty to help you improve certain areas. And what we're looking for is working memory, which I talked about, speech and noise, rapid speech, and then speech reading. So again, that lip reading. And those are the 4 different areas that LACE AI works on. And then again, these are practicing several times a day. It calibrates to your current skill level. It allows you to pick things that you find fun and engaging. So it could be jokes or traveling or anything like that. So you're able to pick the subject matter, and it allows you to even like customize it. So a lot of patients will have difficulty with a particular person, whether it's a child or their communication partner, and it actually allows you to send them a link. They say their like passage to this person, and then artificial intelligence will use their voice to help you train and learn how to hear better. And so that's actually pretty new. LACE, again, has been around a very long time, very, very well documented that it is effective. They have just now created it in a way that is very attainable for everybody to use on a day-to-day basis. So the initial training talks about 15 to 20 minutes a day is what we recommend, cumulative of 10 plus hours, 20 is preferred. And then once you've kind of reached the quota, the maximum amount of training, that is good for 6 months, right? So you still have to like, it's a lifetime of like doing this training. But after 6 months, you can decide, okay, well, I'm gonna do like little bursts of training every day and like 5, maybe 10 minutes, or I'm just gonna go hardcore once I've reached that 6-month mark and just get those 20 hours in again. And so however you decide to maintain it is up to you and your preference and how you like to do things. LACE AI can be purchased like separately, so sometimes patients aren't ready for hearing aids, and LACE AI in itself is an affordable way to start to work on training your brain. So if you're identified, of course we always say hearing loss, hearing aids, LACE AI. But LACE AI is a good intermediate step that's a lot less expensive than hearing aids for individuals, where you can start to just really work on your cognitive function. Hearing aids, we include LACE AI in the cost of our devices because we want everybody to use it. It's going to lead to better outcomes. Patients are going to be more overall satisfied. And when you do log in and have it, what happens is we're like your accountability buddy. So when you're coming in and you're coming every, say, 6 months, I'm able to log online and see that you've been doing it consistently, or give you a little motivation, right? Like, looks like it's been a minute since you've logged onto the app. Like, is there anything that I can do? And it's just more like about that accountability piece to keep you motivated. This is a little video about a person here who has done Lacey and I.
My audiologist and I were talking about my sort of continual complaint that while we would trade up in hearing devices, I still wasn't understanding what people were saying to me. And loudness or pitch wasn't enough. And I was getting frustrated, and I think he was getting frustrated because the devices, however sophisticated, updated, and expensive, were not solving this problem. So he said, you should try this audio program. You can do it on your computer, and it trains your mind in an area where your brain is not processing correctly what people are saying. It isn't that you can't hear them, it's that your brain is not processing the words so that they are clear enough that you understand. And I was surprised at how it's helping. First of all, it helps to begin with when a person uses LACE to at least accept, at the very minimum, accept that that's the problem. So that challenge, accepting that this is an issue, was number one. And then number two was, I think LACE requires a commitment of time. I think that it helps one with practice understand the weak points in your brain, what maybe you understand lower pitched voices but not children, or fast, slower speech versus fast. And then the exercises are exercising that muscle.
Okay, so just an example of somebody who has hearing loss and wore hearing aids but was still like really struggling in background noise, and kind of doing the program. And again, this isn't a quick fix, it's not a magical pill. It takes time, it takes discipline, it takes both of those things, time and discipline, to really get good at it. But it is an area that can be improved. This was just talking about that new and experienced users certainly can benefit from LACE, but the most impactful is somebody who is just starting to treat their hearing loss and using LACE in conjunction, right? So we're seeing that that's going to give you the most positive outcome. It doesn't mean if you have hearing loss and you wear hearing aids that you can't benefit from it, because I've seen it myself with one of my patients who, she's tried everything. She was a hearing aid patient for years and always did like just okay with her hearing aids. And then she tried kind of this new implant, not a cochlear implant. It was like something called, I can't think it was called the Esteem. And because her son had worked for this like ENT company, and they were basically going in and they were like doing a little bit of a surgery, and then you had an external like device. And I mean, this thing was like $11,000, very expensive, and she just did terrible with it. She was like, it's for that much, it's just not doing any more than my hearing aid did. So she ended up being able to remove that piece and getting hearing aids. And I said, if we want to see a difference, I need you to do this. And so that made a big difference for her. She just is like way more active. She's always been active, but she feels much more confident in going out and like her social skills and being able to communicate in complex environments. So the Quicksin is a test that we give patients when they first get a hearing test. It's part of our diagnostic testing. And we're looking to see how much difficulty does this person have in background noise. And the Quicksin is a series, it's 6 sentences. Every sentence gets harder because the background noise gets louder. And it's babble. It's a bunch of people talking in the background, trying to replicate a restaurant type of environment. So the first sentence is here, and the background noise is just kind of very low. And as we go down to the 6th sentence, then they're presented at the same level. No one can get the last sentence. It's very difficult, hearing loss or not. But what we do is we use that as like our starting score to see how much difficulty this person has and how much we can expect them to improve with the training. And overall, I think it said like 3 3 dB improvement, but that can take you from a moderate to a mild. So that can take you from mild to normal. So it can really make a big, impactful difference by doing the LACE AI. So the takeaways: hearing is complicated, requires a lot of effort and understanding in your brain. Treating your hearing loss overall improves your quality of life, improves cognitive function and balance, reduces your risk for developing dementia, and provides the proper stimulation that your brain needs. And your hearing devices do need to be customized because everybody has a unique anatomy, listening preferences, and needs. Because again, it's not one size fits all. Everybody is their own person. Even though your hearing loss might look the same on paper, you're going to have different needs when it comes to how you like to hear. And that's it. So I guess, does anybody have any questions for me?